Hello guys, I am back with another video on FMG question, and today I am going to discuss the anorexia nervosa and bulimia. So let's begin. Anorexia nervosa and bulimia. So what happens in this disorder? It is a eating disorder. Okay. It is caused by intense fear of gaining weight and distorted perception of one's body shape and size. People with anorexia often have an obsessive preoccupation with food, weight, and body image. They may severely restrict their food intake, causing significant weight loss, even when they are underweight. And causes include the psychological factors like a high level of perfectionism and low self-esteem, and a tendency towards depression and anxiety, and a poor reaction to stress. Okay, so think of it like this. So the person has a self doubt about his body image, so that's why he wants to remain fit. So that's why he restricts the food intake. Okay, you can remember it like this. So we have clinical manifestations like extreme weight loss, thin appearance, abnormal blood counts, fatigue, insomnia, dizziness or fainting, bluish discoloration of the fingers, which we call as a cyanosis, hair that thins, breaks or falls out, soft, downy hair covering the body, constipation and abdominal pain, and rest all others. Now, in this case, we have in males there is a decreased testosterone levels and GI problems also. There is a gastrointestinal problems like constipation, bloating, or nausea, and electrolyte abnormalities like low blood potassium, sodium, and chloride ions, and kidney problems also can occur in the anorexia nervosa. Now, let's talk about the bulimia. So, bulimia is a condition in which the patient binges on food and then induces vomiting. It's a serious, potentially life-threatening eating disorder. Okay. Now, this is also a eating disorder, but in this case, the patient eats. Okay, he eats, and after and after eating, he regrets the decision of eating. Okay, so he induces vomiting. So that is called bulimia. Okay, bulimia is more common than anorexia nervosa and carries a better prognosis. Now you only tell me that in this bulimia, patient eats. Okay, at least he's eating something. Okay, in anorexia nervosa, the patient does not eat. Okay, so it causes the underweight features. Okay, so the exact cause of bulimia is unknown. Many factors could play a role in the development of eating disorders, including genetics, emotional health, so societal expectation, and other issues. Now, coming to the risk factors. So, risk factors: girls and women are more likely to have bulimia than boys and men. Bulimia often begins in the late teens or early adulthood. So now, signs and symptoms. Being preoccupied with body shape and weight, living in fear of gaining weight, repeated episodes of eating abnormally large amounts of food in one sitting, and then forcing to vomit this eaten food to get rid of food, and using diuretics or emetics. Okay, after eating when they are not needed, and diuretics are the medication that induce the urine, and yeah, and emetics are the devices or the medications which are used to induce vomiting, and after eating when they are not needed, fasting, restricting calories or avoiding certain foods between binges, using dietary supplements or herbal products excessively for weight loss, The severity of bulimia is determined by the number of times a week that you purge, usually at least once a week or at least 3 months. Now complications. So, negative self-esteem and problems with the relationships and social functioning, dehydration, which can lead to major medical problems like kidney failure, heart problems like arrhythmias or heart failure, and menstrual irregularity in women, digestive problems, anxiety, depression, personality disorders or bipolar disorder, misuse of alcohol or drug, self-injury, suicidal thoughts or suicide. I have a question for you. Binge eating differs from bulimia by. Now pause and try to answer this question. So what is the difference between binge eating and bulimia nervosa? So binge eating disorder refers to the recurrent episodes of binge eating without compensatory behaviors. Individuals with bad experience or loss of control during binge episodes, consuming large amounts of food in a short period. Okay. Bad is often associated with emotional triggers and is not specifically driven by concern about body weight or shape. This is important, guys. This is very important. Unlike bulimia, individuals with BED do not engage in compulsive behaviors like vomiting, exercise, or fasting. Okay. Now, bulimia nervosa. In bulimia nervosa, there is also the recurrent episodes of binge eating, but it is also characterized compensatory behaviors to prevent weight gain. Okay. After binge eating, these individuals they may induce self-induced vomiting. They may use diuretics to cause urination and vomiting to expel the food which they have eaten. So in the bulimia nervosa, what happens that there is a compensatory mechanisms, okay, to prevent the food to enter the GIT. Okay. Now people with bulimia often have a strong fear of gaining weight and a preoccupation with body shape and weight. Okay. Unlike binge eating, where there is not where there are no triggers as such in the bulimia nervosa. And bulimia is associated with cycles of binge eating followed by compensatory behaviors which can occur multiple times or a week or even daily. Okay, so our answer will be both option A and C. Option D. Question number 2. A friend of yours has irritated teeth and goes to bathroom after meals and is refusing to go to party. You suspect which disorder? Pause and try to answer this question. Now, the symptoms are frequent trips to bathroom after meals and social withdrawal could potentially be indicative of a bulimia nervosa. Bulimia nervosa is an eating disorder in which we have recurrent episodes of binge eating followed by compensatory behaviors to avoid weight gain, like self-induced vomiting, misuse of laxatives, or excessive exercise. Now, the erosion of teeth can occur due to repeated exposure of tooth enamel to stomach acids during episodes of self-induced vomiting, which is a common behavior in individuals with bulimia. The frequent trips to bathroom after meals could suggest purging behavior to eliminate the consumed food. Social withdrawal is also common among individuals with bulimia due to feeling of shame, guilt, and embarrassment associated with, with their eating behaviors. They may also avoid social situations, especially those involving food. Okay, so I have got a study question for you, and write the answer in the comment box. So the first dietary objective in the treatment of anorexia nervosa is. So how will you first treat the anorexia nervosa? So option A is the stop weight loss. Option B, increase physical activity. Option C, decrease physical activity. Or option D, eat food with high fiber content. Now I will pose this question in my poll and try to answer this question. Thank you guys for watching the video till the end. It means a lot to me. Thank you.